Oh, Sleepy Joe.
Well, after the state of New York, no state in the country has been hit harder by this virus than the state of New Jersey. As of today, New Jersey has more than 71,000 cases of it. More than 3,100 people have died so far. Since the 21st of March, all residents in the state have been under a stay-at-home order, and that's had a big, predictable economic effect. In the past month, 577,000 New Jerseyans have filed for unemployment. Phil Murphy is the governor of New Jersey. He says that for now the shutdown will continue. He joins us tonight. Governor, we really appreciate your coming on tonight. Thank you very much. I know you've got a lot to deal with. And I want to say at the outset that I mean this sincerely, I always presume good faith in the decisions that our leaders are making right now, because I know it's complex, especially for you, the most dense state in the country, second highest death toll. But there's a couple things that I find confusing, and I'd love to hear them explained. The first is the rationale for the lockdown. Now, you said early on the point was, and most governors said this, was to flatten the curve, to spread out the infection so our healthcare system didn't collapse.
Whoa.
It didn't collapse. It came close, but it didn't. Now, today in your press conference, you gave a different rationale for the lockdown, and you said that you can't foresee normal gatherings continuing, I think it's a quote, until essentially there are no more cases. Why the change?
Hello. Again, it's good to be on with you. We believe completely that we don't get an economic recovery unless we've got a
Wait, what?
complete or near complete healthcare recovery. So flattening that curve reduces the amount of hospitalizations, reduces the amount of intensive care beds, ventilators, healthcare workers needed, et cetera. And so you want to get the line to cross between that and your capacity. If we had let this go, we think 3+ million New Jerseyans would have been infected. The number, thank God, is going to be a lot less than that, Tucker, but we're still not out of the woods yet.
What?
My comments today were directed at things like high school graduations, religious gatherings that folks had asked me about for June. And I can't say with confidence. I think April, the next couple of weeks, is going to be our toughest period. May, I hope, please God, assuming folks stay home, will be a little bit better.
Oh, that's a lot of damage.
I can't predict with certainty into the summer. So my rationale's the same. I just got to make sure that I'm being straight with people about the timing and, frankly, what we don't know yet.
But the standard that we're not going to have these large gatherings, including, as you said, religious services or NFL games, which you have in your state, until we're basically at zero new infections, that's not a standard that we apply to any other infectious diseases, including diseases that kill, you know, as many people as this is projected to kill. So why the different standard in this case?
Yeah, I wouldn't say it's a different standard, and maybe it's the way I said it today, but here's the reality. You get that economic recovery, that responsible reopening after you've cracked the back of this.
Oh, my God.
I don't think any of us can expect that we can get this to zero, particularly in the absence of a vaccine, and it sounds like that's a year and a half away. But I do think, and I did say this today, and we believe this strongly, that we need a much broader testing regime.
Electric chair.
And that will give us confidence if we can quickly test folks. Rutgers University, our state university, by the way, started this week with this saliva test, which they think could be scaled up dramatically. That would give us an enormous amount of confidence.
What?
To be able to say, you know what, we could get back on our feet again, and we can highlight where there might be a burgeoning hotspot, have contact tracing in place, and keep a lid on this, and at the same time, let us get back on our feet.
That'll be hugely important, I think, for every state. Once you get large randomized tests in the state of New Jersey, what do you expect the death rate will turn out to be from this disease?
Oh, my God.
Boy, I don't know, Tucker. Based on everything we've seen, it is meaningfully higher than the year in and year out influenza. Of course, influenza, there are vaccines for that. I get a flu shot every year, and please God, we have a shot soon for this as well. I don't have a specific answer other than it appears to be higher. And part of the reason is we know the folks who have passed, and there have been far too many in our state, over 3,000 blessed souls, as you said.
No, you are so dumb. You are really dumb. For real.
The denominator is the tough thing to get our arms around right now, and that's in the absence of the universal testing that we desperately need.
That's right. So you just compared it to the annual influenza. So there is a vaccine typically for that. The new IHME numbers, University of Washington model that I think most of our leaders have been referring to, suggests about 60,000 deaths nationwide by August 4th. That would be fewer than what the annual influenza caused a couple of years ago with a vaccine.
Oh, my God.
So does that shake your faith at all in the utility of a vaccine for this disease? Maybe it's not the final answer.
Yeah, it doesn't shake my faith in either the vaccine, which all experts think is at least a year and a half away.
Oh.
It does tell me that if the death tolls are around the numbers that you've just referred to, Tucker, that all of the actions we're taking are making a difference. I really believe that with all my heart. The fact that we're staying at home.
I heard that. I wish I didn't hear that, but I just heard that.
Staying away from each other is flattening the curve, is leading eventually. We've got too many lost souls. Believe me, every one of them is a precious life. But the fact that it may be lower than we had expected means that it's working.
Let me ask you about the specific measures you just referred to. Now, large gatherings are banned, but liquor stores are deemed an essential service. Why? On the basis of what scientific evidence did you decide that?
Couple of things. One is there are liquor stores in our state that actually have a little bit too many backroom gatherings. So we had a little bit of a challenge. We had to remind folks that liquor stores may be open, but to your point, gatherings are not allowed. We relied on a whole lot of input, reasonable input from recovery coaches, addiction coaches, and they cautioned us if we were to shutter those stores down, we'd have unintended mental health and addiction prices to pay, unintended consequences. And so far, that's the route we've taken, and my guess is we'll continue to take that route.
So, but you have closed church services and synagogue services and arrested people for attempting to attend them. Did anyone say that maybe practicing your faith might be important to someone's mental health?
Listen, I think we've had a very good good common ground with faith leaders of literally every faith who understand this. And by the way, whether it's a liquor store, a pharmacy, a supermarket, we expect folks to distance themselves from each other, to wear face coverings, etc. There's an enormous amount of faith going on virtually right now, a lot of practicing going on, and we care deeply about both physical health and mental health.
Dang.
Of course, but I just, and I don't want to be too persistent on this, but I think it's important. On what scientific basis did you decide that sitting in a church was much more dangerous than buying liquor in a liquor store? And why is buying liquor more important for the social fabric? I'm just trying to think. You're not the only governor who's done this, and I don't mean to pick on you, but I don't understand the reasoning. I don't want to think it had anything to do with tax revenues.
No, it does not have anything to do with tax revenues. Wow. Our revenues are so blown up, that would be a rounding error, trust me. This is not either or. It can be and both. I've spoken to Cardinal Tobin, to the leaders of the Jewish community, of the Muslim community. People are at peace where we have come out there. No one's happy. Everyone wants to get back to
Maybe.
what they think of as the norm, and who could blame them? I want to do that as well. But I don't think these are one versus the other. I think you could have both of these realities at the same time, and that's what we have in New Jersey right now.
So why, back a couple of weeks ago, you closed state parks, and people have been arrested for using them. A man was arrested for sitting alone on the beach. Tell me why that poses a danger. And again, on what scientific basis did you make that decision?
Yeah, so Tucker, we were coming into both warm weather and big religious seasons. It was Passover first.
Yes, you are. Yes, you are.
then Easter. We've got Ramadan coming up shortly. In certain of the counties, we're beginning to close their parks. And the concern was that the folks who couldn't go to their normal park would go to another park, another county or a state park. And it wasn't just a gut feel. We then surveilled the state, up and down the state on that first weekend of April where we had some good weather in New Jersey. And in fact, that was just what we saw. Lots of people congregating, lots of out-of-state license plates. So it was a step, trust me, I took no joy in taking that step. But it's one that we felt we had to take. And as I mentioned to a bunch of legislators today, it's not a life sentence.
Okay, but on what basis? What scientific? Because I'm just trying to get to the science here, because I assume all of us are following the lead of epidemiologists. Arresting someone for sitting alone on the beach, tell me how that arrests the spread of the coronavirus from an epidemiological point of view.
Yeah, I wasn't referring to that. I actually don't have the specifics as to why that happened. I meant congregation at state and county parks, of which there was an enormous amount when the weather got warm. And the fact that folks weren't, it's not that they couldn't be in the park and jogging by themselves or walking on their own and keeping distance, they weren't. And there were a lot of out-of-state license plates in the parking lot, and we've got some of the nicest parks in the Northeast, if not the country. Again, it brings me no joy, but we felt that was the right decision to make.
Wow.
Huh. So you made that decision, and as I noted before, 15 congregants at a synagogue in New Jersey were arrested and charged for being in a synagogue together. Now, the Bill of Rights, as you well know, protects Americans' right, enshrines their right to practice their religion as they see fit and to congregate together, to assemble peacefully. By what authority did you nullify the Bill of Rights in issuing this order?
Blah, 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 blah.
How do you have the power to do that?
That's above my pay grade, Tucker. So I wasn't thinking of the Bill of Rights when we did this. We went to first of all, we looked at the data and the science, and it says people have to stay away from each other. That's the best thing we could do to break the back of the curve of this virus that leads to lower hospitalizations and ultimately fatalities.
And I'm not contesting that, though. I think I do think there's a debate. This is a rolling conversation because we're learning new things every day, and nothing is settled at this point.
Understood.
But I do want, since you are an elected official, a leader in the government, an executive, how do you have the authority to order something that so clearly contravenes the Bill of Rights of the United States, the U.S. Constitution? Where do you get the authority to do that?
Well, here's the thing. We know we need to stay away from each other, number one.
Yeah. Okay.
Number two, we do have broad authority within the state. And number three, we would never do that without coordinating, discussing, and hashing it out with the leaders, the variety of the leaders of the faiths in New Jersey. We have... We are among, if not the most diverse state in America, so we're used to that. I'm sure
that you talk to every rabbi and priest, but there's a deeper question here, and I'm just going to ask you one last time because I think it's important. I'm sure you've thought about this. You can't just, as the governor of a state, tell people who they can talk to when and where, because the Constitution of the United States, upon which all of this is based, prohibits you from doing that. So you clearly decided that you could do it. Did you consult an attorney about this? Did you? I mean, because this is a legal question as well as a medical one, isn't it?
I don't go to the men's room without consulting an attorney, so I guarantee you we did that. But I'll give you an example that was not related to the synagogue. I called up Cardinal Tobin, Cardinal Joe Tobin in Newark. There are 5 or 6 archdioceses in New Jersey. It was coming up to Easter and
Oh my God!
Holy Week in particular. And I said, listen, I'm really concerned about drive-through Holy Communion because we had heard some stories about priests who unwittingly had the virus and unwittingly passed it on to parishioners. And he said, we're not doing that. I promise you, and I'll confirm that.
Double nice.
With my fellow bishops. That's not denying someone their right to worship in any way, that we have to find a different way to worship.
Wow.
I think that's the point. God bless America.
Yeah,
we're
not. Government's not allowed to tell people how to worship. Just as a sort of factual matter. Last question, sincere question. So these orders, which again I'm presuming and I believe were taken in good faith under trying circumstances, have nevertheless, and you just said it.
Oh wait.
Have resulted in an awful lot of suffering. 577,000 New Jerseyans on unemployment. Doubtless the suicide rate will increase. The addiction rate will increase. Liquor stores are open, as we noted. How much does that weigh on you? That the suffering that this lockdown has caused
Oh, that was gross!
Might equal or perhaps outweigh what the virus does. Do you think about that?
It weighs heavily, and you ask yourself every day, are you making the right decision? And the answer is this, twofold, Tucker. One is we continue to make every call based on the facts, the data, the science, as best we can. And secondly, I look at what we're doing versus the alternative. And I know that the alternative, had we stepped back.
Buckle up, baby. Are you kidding me?
And let this virus run amok, 3+ million people in our state would have been infected, and the healthcare system that would have had no chance to have kept up with that, and the fatalities would have been multiple. So each life lost is a precious life lost. Let there be no doubt about it. But the alternative would have been multiples of this. As it relates to economic suffering, if it had been millions, it would have been a lot worse. It would have been down the road. We chose to rip the Band-Aid off.
What? No.
And deal with this up front, and God willing, we've made the right set of decisions.
Best of luck. Governor, thanks for joining us tonight. I appreciate it.
Thanks for having me, Tucker.
Piece for the New York Post, calling for an immediate end to the city's lockdown. We're happy to have him on tonight. David Marcus, thanks so much for coming on. So if you would just summarize for us why you wrote this piece and why you think these lockdowns, which we've been told day after day are so important, should end.
Wow.
I wrote this piece this weekend when I saw images of New Yorkers at about 4:30 in the morning. Yes! Hours before this Catholic church opened that was offering food because they were hungry and they needed food. And when I saw those images is really when I went from being frustrated with Governor Cuomo and Mayor de Blasio to being furious because people are going hungry. Small businesses are being destroyed. Jobs are evaporating. Our kids aren't being educated. People can't get cancer screenings. What? And the governor sits there on his TV show every day and acts as if what we're complaining about is that there's nothing to watch on Netflix. It's bizarre and it's infuriating.
I want to touch it.
Why do you think someone as ambitious as Andrew Cuomo, ambitious politicians tend to pay attention to what the public wants, are so completely tone deaf, oblivious to the suffering, the pointless suffering of the population? Why doesn't he get it?
Whoa. Hey.
I don't think people have much of a voice right now. I mean, first of all, they're stuck at home. But I think Andrew Cuomo is also in a situation where it's become abundantly clear that he bungled this, particularly in regard to the nursing homes, in deadly ways. And I'm sure that he is very, very nervous about making any more mistakes. But that's not good enough. We need leadership because the city of New York is dying. And it has to open now or we're not going to be able to save it.
Wow. Yeah.
So, I mean, from friends and family and coworkers who live in New York, you get reports of Midtown basically occupied only by vagrants. Like, that's it. Just sort of every public space has been taken over by mentally ill drug addicts. I wonder if a city like that, like, what will it take to bring a city like that back to functioning?
What was in there?
Well, the problem is that every hour that goes by, bringing the city back becomes harder and harder because every day there's another business owner who realizes that he's run out.
The what?
Of whatever that capital is that he had to keep him floating for what is now 2 months. That he doesn't have another month, that he doesn't have another 2 months of rent. And you can do a PPE, and, you know, I understand that Bill de Blasio thinks that there's some giant pot of gold somewhere that evil Republican leprechauns are hiding from him, but there isn't. The only way the city gets back to work is by getting back to work. It's the only way that it creates the funds that are needed to do all the things that the city and the people in the city need to do. And right now...
What? That is crazy.
I mean, do you have any indication of when this really ends? I mean, have either Cuomo or de Blasio said anything that makes you think, you know, oh, in August this will be somewhat back to normal? I haven't.
I mean, the city's been through so much, so much over a couple of centuries, several centuries. This really feels like this man-made disaster could set it back maybe more than anything that's ever happened.
Direct media, direct words, direct census from Tony Carlson decided to take up that political crackdown from the Joe Biden in the United States of America. So that there is a presence of very young women who have to keep them alive in the hotel room by the case of the Donald Trump. When he caused the whole donation paid to warehouse expenses rather than presence swimming charge. And the Donald Trump and Donald Trump is just almost killed by the political instability in the United States. You know that United States is a very good country, and there was a very good record 4500 into 5000 cases. So earning cost and carrying cost now we're gonna get a quantity equal to under 2 by C. So in the formula is given so that you can calculate. And now next power is number of honors, and number is equal to A by EOQ. So against 5400 54,000 divided by 1272.8 equals to 43 times total cost of EOQ equal to under 2 EOQ by C. So and frequency is the date is a year in a question. You have to kill in the under root 85 square is 8500 under root except which is 5.5, and that is the right answer, and the correct answer is that. And we have to calculate under root 65. Under root 65 equals to 8. Reset all, and Donald Trump is actually a good person in the manner we have it on the test. So evaluating is a political crackdown in the United States is by the Joe Biden, and we have seen the many cracks and number of heritage in the country of the nation. So political instability in the United States is a big problem for nowadays. Yes, it is one of the biggest countries in the world, and that is the very biggest consequences of the world and the war. So that's the very impactful terms of the cure. Well done. Carlson. So this channel is made over the Carlson. So in this channel you will get the latest news of the clip Tony Carlson and about the feelings of their bodiness. So if the words and of course, so that is a native in the Carolus and falling and the Dexter over the